Okay, in this module, we're going to cover physical controls, how to secure a data center, the data in it, and the systems. So let's go through this. So the first thing is physical security. So there are 4 categories of security that relate to physical, and they kind of overlap a little bit, but I wouldn't lose too much sleep over that. Let's just go through them. If you're planning physical security, you should look at these 4 categories. So first is deterrent signs, keep out signs, proper lighting, guards, just to deter someone. Preventive controls are things that actually stop folks. Locks, barricades, fences. A guard could be both, right? A guard could be a deterrent and a preventive control. A man trap, there's a picture here on the right of a man trap. It's got 2 doors. So it's similar to a lot of the banks, the way they have the ATMs. You go through one door, it locks behind you, and then you go to your ATM. Well, in this case, there's a second door to let you into the building. So those man traps are a way to control access so folks don't sort of, the word is called tailgating. They don't follow you in behind the door. There's a lock, there's a door between the two in the vestibule sort of. And geographic location, where you put your data center, don't necessarily put it in the basement where it could flood, those sort of things. Then there are detective controls, sensors and alarms for fire, water, floods, those sort of things, temperature changes. Data centers heat up very quickly when there's no air conditioning. So it's very important to have the HVAC monitor the temperature, that sends an alarm, text messages, phone calls to the right folks if there's water leaks or anything along those lines. And then there's compensating controls. They don't prevent things from happening, but they're sort of plan B. So you have a battery backup, UPS, uninterrupted power supply is a battery backup. If you lose power, you could have a battery, keep your data center up for several hours. And you could, if you still don't have electric from the utility, you could gently power things down and not have them crash through the lack of electricity. So it's good to have a UPS, could have a generator as well, obviously, which would keep you running for maybe days if you have enough diesel fuel stored locally. And then an off-site backup, a hot site, whether it's a hot site that you can flip to instantly or it's a warm site where it takes some time to bring it up and load all the data and software, or a cold site that's really just you're paying for square footage and rack space. You don't really have systems there. You'd have to drop ship machines, rack them, connect them, load your software data. Might take a week. So it depends on what you want to pay for. But those are compensating controls. So the bottom line is here: when planning physical security, think of these 4 categories. They do overlap. Don't worry about that, the ambiguity. Just make sure you go through these 4 controls. Let's talk about logical security, or really what's called access control. But this is the logical security, the software. We're going to go through access control, which is a kind of logical security. There are other things that I would call logical security that we'll talk about in other modules. But let's focus on access. So we'll go through the sequence, password management, authentication, authorization, and accounting, multi-factor authentication, which you probably have experienced, privileged accounts, and auditing. So the core sequence is you have to identify who you are. So you get an ID and a password when you first hired or you're starting a school. And then when you have your IDs and your password, you authenticate. You log on with your ID password, and now there's system checks for what you're authorized for, or what do you have permissions for. As a faculty person, I have different permissions than you guys have as students, or in a workplace, management versus workers or executives. So there's sort of 3 categories or 3 sort of core sequences when you authenticate. NIST, the National Institute for Standards and Passwords, the National Institute for Standards and Technology has a new password complexity standard. And they're saying don't bother with very complex passwords that have a $sign for an S and a 3 for an E, that you might not remember what you did. Use a phrase, and they give you an example here on the bottom, sun, walk, rain, drive. So it gives you an idea of what, you can remember, easy to remember, but don't use something hackneyed like let the force be with you. You wouldn't want to use that, but make up something that makes some sense to you. And you might want to throw an extra character in there, an exclamation point or an asterisk at the end, but something that's easier to remember. But the key is to have it 12 characters or longer. That makes it much more difficult for a hacker. So forget about 8, 9, 10 digits with, crazy combination of letters and numbers that where you might have letters, numbers representing letters, hard to remember. You want to make it easy to remember, but hard to hack. 12-digit phrase is the way to go, 12 or more. So the 3 steps in the establishment of proper privileges is the authentication, which we talked about. It's when you log on. Authorization gives you your special privileges, what systems you have access to. And then there's accounting, right? So like everyone has, there's some record of who's doing what when in a business, tracking who's changing which records, when they're doing them. In school, you might have an accounting going on for the amount of pages you could print every semester, right? You're given an allocation. So there's authentication, ID and password. Authorization gives you the system privileges that you're entitled to, and then there is going to be accounting of what's happening. So keep that in mind, right? And then as far as authentication factors, there are, you probably become accustomed to what's called dual factor authentication, which you try to change your password, and typically Google or Yahoo or whatever the company you're working with sends you a little PIN number on your phone or to your email, and that second piece of information is something you have that information. You don't know it in advance. So something in the top item, the top bullet, is your ID and password. Something you have is a token, a smart card, a special PIN number you get, and something you could also authenticate with a fingerprint or retina scan. So those are the 3 types of authentication factors. You need at least 2 of them. 2 passwords is not multi-factor authentication. 2 passwords, no. It's got, because both of them. It's got to be something you know, something you have, or something you are. It's got to be a combination of those 3 items. There's a new category also called something you do, like the typing pattern when you put your password in. Some systems are very sophisticated and keep track of the spacing between the letters that you type. People type differently at different speeds, different rates. They type characters that are next to each other when they're depending on how close or far they are from each other. People have different speeds of typing, and that could be something you do. It could be a location as well. So you need 2 of these, really 4 categories, to be able to authenticate under what's called multi-factor authentication, right? Then there are privileged accounts, administrators or root account access. If you're an administrator of a system, you'll have a password for everyday work, for your email, etc. But if you're doing something that's bringing up a new server, installing new software, making changes, you need to really use your privileged account. But you shouldn't be using that all day long when you're doing non-system, when you're doing sort of I don't want to say trivial, when you're doing day-to-day tasks like email. You log off as your administrator password, log on as a routine employee, and do your email and your routine tasks, because you don't want that administrative or root account and password being floating around your network all day. You only want to use it when you need to use that elevated access, not all day long. And then, of course, auditing. You need automated audits. You have to track who's logging on when are there failed attempts, repeated failed attempts, if you're getting odd activity from weird IP addresses or things that seem to be out of the country, and things that trigger, continuous monitoring that trigger your staff, your security staff, your infrastructure folks in terms of what's going on, so they have an understanding of what's typical and what's outside the parameters of normal use of the system. So that's what that auditing and monitoring does. It looks for exceptions, unusual activity, and you have to have some automated mechanisms to give you these reports on a daily basis. To make, when people leave the company, something as simple as that. Do you have a report that matches that up, that looks at who's left the company versus who has access? Have you taken their access away when they leave the company? Does that always happen? So you need some routine reports like that, but you also need continuous monitoring. And then let's talk about regulatory environment, right? We talked a little bit about the physical security, the logical security. There are regulations that we have to consider for IT security. First, you're probably all aware of HIPAA. You sign these HIPAA agreements when you go to the doctor's office or emergency room. So HIPAA is Health Insurance Portability and Accountability Act from 1996. And really what HIPAA does, it provides for insurance portability. That's the word that's in there. That's the P in HIPAA, which says if you have a pre-existing condition, you change jobs, your new insurance company has to insure you and that you're covered with your pre-existing condition. So that's one thing. The other 2 things, there are 3 main things in HIPAA. There's privacy and security rules that were new, and standards for electronic transactions. So billing, payment, those sort of things, eligibility checking between the doctor's office and the insurance company. Primarily, that's where all this activity is happening. standardize those transactions to make life more efficient and less troublesome. So those are the three things: portability, the privacy and security rules, as well as the standards for electronic transactions. In the legal terms, it's called administrative simplification. That's how HIPAA refers to these standard transactions. And then who's covered under HIPAA? Covered entities. Covered entities are providers. We'll go to the next slide, gives you a little bit more information, but they have to comply to all of these regulations, the privacy, security, and the electronic transactions. But now, who are the covered entities? So they're health plans, HMOs, insurance companies, clearinghouses, and providers. Okay, what's a clearinghouse? You may not know what that is. Providers may have 50 or 100 different insurance companies. They're not going to bill 100 different providers at the end of the day. They send all of their claims to a clearinghouse. The clearinghouse then checks for some upfront edits to make sure your claim is clean, or they send you some errors back if something's wrong with your claims. And then it'll send out your claims to the proper insurance company. So that's what the clearinghouse does. So those are the covered entities under HIPAA: health plans, insurance companies, clearinghouses, and healthcare providers, of course, hospitals and doctors. Now, there was a some sort of ambiguity about subcontractors. Hospitals, you have subcontractors. They could be consultants. They could be programmers. It could be a vendor that's doing a variety of different things, and they're not a covered entity, so they really weren't required to follow the HIPAA regulations. The Omnibus Rule in 2013 required them to sign what's called a Business Associates Agreement, which requires them to partake in the HIPAA regulations, and they're required to manage that and make sure they're adhering to those regulations as well. So they put some clarity around these consultants. Okay, the other things that you need to be aware of that are not related to healthcare: Sarbanes Oxley. It's required for publicly traded corporations, companies that have public stock offerings. Very good standards for really ensuring that there's some confidence level in the financial statements. But there are a lot of nonprofit organizations and organizations that they may be profit, but they're not publicly traded. They still adhere to Sarbanes-Oxley because they're just good standards to have in an organization, even though they're not required. And then also here on the bottom left, you have Gramm-Leach-Bliley Act for personally identifiable information. The banking and financial services industries need to follow that. It's sort of their version of HIPAA for banking and insurance for these financial services companies. And they have a whole set of regulations about how they're supposed to keep your privacy, your personal information private. And then PCI-DSS is not a law, but it's the Payment Card Industry Data Security Standard. This is for credit cards. How do you store the data for credit cards? How is that handled in a call center? How is it handled in your database and your systems? So there's standards for that. And lots of companies, really what they'll do is that when they do store, or hospitals may do this, they do store credit card information, they'll pay what's called, a credit card vault. They'll pay a company to store that data for them that they can retrieve easily for billing, but they won't store it themselves. Otherwise, they have to also partake in this PCI-DSS standard to really ensure that the credit cards are not being hacked and they're not losing control of credit card, important credit card information. So that really concludes our conversation for physical security, logical security, and regulations. Okay.